certain questions in the last chapter what we have discussed in the class. That means back of the thigh and popliteal region, popliteal fossa. I'll ask you certain questions, very simple questions only, and you have to answer. We shall divide it into 6 groups. First 2 benches are one group, next 3 benches second group, the last 2 benches third group, and here also the last 3 benches fourth group, then the next 2 benches fifth group, the next 3 benches last group, that means 6th group. I'll ask one question for each group. Suppose if you are saying, you will get 1 point. Suppose if you are not getting it, I'll go to the next team and I'll ask them. Suppose if they are answering, they'll get half point. Okay, otherwise I'll get 1 point. Got it? Finally, I'll give this chocolate. Which team is winning, I'll give this chocolate. Okay, now for now I am having only 1 chocolate, otherwise I'll give some other thing. Okay, fine, I'll tell you the suspense finally. Okay, first question, can you tell me the name of the nerve which is supplying the back of the thigh? Yes, 1 minute.
So sciatic nerves.
What is that?
Sciatic nerve.
Sciatic nerve. Yeah, right. Good one. Okay, that means this team is getting 1 point. Okay, 1 point. The next team. Okay, can anybody tell me what are the components present in the sciatic nerve, or what are the parts compressed in sciatic nerve? Yes.
Sir, it comprises of 2 components. They are tibial component and common peroneal component.
Good, right? Your team also getting 1 point. Okay. So the sciatic nerve comprises of 2 components. One is tibial component, another one is common peroneal nerve component. Right. The third question. Can anybody tell me what is the nerve supply for biceps femoris short head? Yeah, 1 minute.
It supplies by common peroneal nerve, part of the sciatic nerve.
Yes, right. Good. So the biceps femoris, short head of the biceps femoris muscle is supplied by the common peroneal part of the sciatic nerve. The other part, the long head of the biceps femoris, is supplied by the main tibial part of the sciatic nerve, right? Okay, fine. Then the next question goes to this team. Can somebody tell me the contents which is present in the popliteal fossa? Yes.
Popliteal vein, popliteal artery, popliteal lymph nodes, medial nerve, tibial nerve, common peroneal nerve, cutaneous nerve, obturator nerve, fat.
Sciatic?
Fat.
Fat deposition. Fat. Yes, right. So that is also right, because the knee joint is having lots and lots of anastomosis by means of genicular veins. So it has to be composed of with lots and lots of fat. So the superficial fascia which is having subcutaneous fat, that is deposited over there. Okay, so I look at the contents, it protects that content which is present in the popliteal fossa region. Okay, good. The next team. Which side is called as a dangerous side of sciatic nerve? Yeah. Tell me.
Medial side is the dangerous side of sciatic nerve.
Yes. Okay. Right. So medial side of the sciatic nerve is called the dangerous side of the sciatic nerve, because medial side only has lots and lots of branches. So it is easy for the medial region to get injured or punctured. So only we say the medial side is dangerous side and lateral side is comparatively safer side. So that only we prefer supero-lateral side as the site of injection for any patients, right? In the gluteal region we inject like here, right? That's the reason. Okay. And the last question here, Can anybody just name me the muscles which are present in hamstring group? Names of the muscles present in hamstrings group.
Semitendinosus, semimembranosus, biceps femoris, adductor magnus.
Biceps femoris, adductor magnus. Yes, right. Okay. Okay, the hamstring group comprises of semitendinosus, semimembranosus, adductor magnus. In that particularly hamstring spot of the adductor magnus or else ischial part. Then finally the biceps femoris. Adila only the long head of biceps femoris is comprised in hamstrings. Along with this, if you add biceps femoris short head and adductor magnus adductor head, it will combinedly together called as back of thigh muscles. Right? Got it? Okay, fine. I think everybody scored good marks. Scored good marks. So let us applaud ourselves. Fine. Thank you. Namaskar. ये अब तक के मुख्य समाचार. Okay. Chocolate. Which team have to give? All or everyone has scored equal marks. So this chocolate belongs to me. Okay. For now, this chocolate belongs because it's a credit for the teacher, right? So it's a good thing. Everybody scored good marks, so it's a credit for teacher. So I gift it myself. Okay. Thank you.